Hello and welcome back to Medicts channel, where we bring you the most relevant and informative content on optimal health and well-being. Today's video is part of our series on aching joints. Everything you should know. If you're new here, don't forget to hit that subscribe button so you won't miss any of our valuable content. And for our loyal subscribers, as always, we appreciate your support. Watch till the end and let us know in the comments where you're watching from. Now, let's dive into today's topic: chronic knee pain. Chronic knee pain refers to long-lasting discomfort, stiffness, or pain in the knee joint that persists for more than 6 weeks. Various factors, such as injury, aging, or underlying medical conditions, can cause this type of pain. Now, let's explore the causes of chronic knee pain. Chronic knee pain can arise from numerous sources, including osteoarthritis, the most common cause of chronic knee pain. Osteoarthritis occurs when the cartilage in the knee joint breaks down over time, leading to inflammation and pain. Rheumatoid arthritis, an autoimmune disease that causes inflammation in the joints, including the knees. Meniscus tears. Injuries to the cartilage that cushions the knee joint can cause persistent pain. Tendinitis, inflammation or irritation of the tendons surrounding the knee. Bursitis, inflammation of the small fluid-filled sacs, or bursae, that cushion the knee joint. Ligament injuries, sprains or tears in the knee ligaments can lead to chronic pain. Gout, a form of arthritis caused by a buildup of uric acid crystals in the joints. Infections in the knee joint can cause chronic pain. Each of these conditions has unique characteristics and can contribute to persistent knee pain. Next, let's discuss who is at risk for chronic knee pain. Several factors can increase your risk of chronic knee pain. Age. Older individuals are more susceptible due to joint wear and tear. Weight. Excess weight adds stress to knee joints, leading to chronic pain. Genetics. A genetic predisposition to specific conditions can increase your risk. Occupation. Jobs requiring repetitive stress on the knees can heighten your chances of chronic knee pain. Previous injuries. Past knee injuries can make you more prone to future issues. Now, let's review the symptoms of chronic knee pain. If you're experiencing chronic knee pain, look out for these common symptoms. Persistent pain or discomfort in the knee. Swelling or inflammation around the joint. Stiffness or reduced range of motion. Weakness or instability in the knee. Popping or grinding sensations during movement. Consult a healthcare professional for proper diagnosis and treatment if you experience any of these symptoms. Diagnosing chronic knee pain. Your healthcare professional will review your medical history, perform a physical examination, and may order imaging tests, such as X-rays, MRI, or CT scans, to help identify the cause of the pain. Now, let's discuss various treatment options for chronic knee pain. Chronic knee pain treatment options can include medications, over-the-counter pain relievers or prescription medications to reduce inflammation and pain. Physical therapy, exercises to strengthen muscles around the knee and improve flexibility. Assistive devices, braces or orthotics to provide support and reduce stress on the knee. Injections, corticosteroid injections to reduce inflammation or hyaluronic acid injections to lubricate the joint. Surgery, in severe cases, arthroscopy, joint replacement, or joint repair may be necessary. The long-term outlook for chronic knee pain depends on the cause, severity, and effectiveness of the treatment plan. Many people can manage their symptoms with conservative treatment methods, while others may require more invasive interventions. Now let's talk about preventing chronic knee pain. Preventing chronic knee pain. By taking a proactive approach to your health, you can reduce your risk of chronic knee pain. Here are some strategies to consider. Maintain a healthy weight to minimize stress on the knee joints. Exercise regularly to strengthen the muscles surrounding the knee and improve flexibility. Choose low-impact activities, such as swimming or cycling, to reduce stress on the knee joints. Practice proper techniques and use appropriate equipment when engaging in sports or physical activities. Warm up and stretch before physical activity to help prevent injuries. Gradually increase the intensity of exercise to avoid overloading the knee joint. Wear supportive footwear that provides adequate cushioning and arch support. Incorporate anti-inflammatory foods into your diet to help reduce inflammation in the body. Seek medical advice promptly if you experience persistent knee pain, as early intervention may prevent the progression of chronic pain. In summary, chronic knee pain is a common condition with various causes, including aging, injury, or underlying medical conditions. The long-term outlook depends on the cause, severity, and effectiveness of the treatment plan. By taking preventive measures, you can reduce your risk of chronic knee pain. That's it for today's video on chronic knee pain. We hope you found this information helpful. If you haven't already, please hit the subscribe button to stay updated on all our health and well-being content. Don't forget to comment below and let us know where you're watching from. As always, our channel is coordinated by medical professionals, so you can trust the information we provide. Thanks for watching, and we'll see you in the next video.